All right, hello everyone. Thanks for staying with us in the main room for animal health as an entry point for engagement session. My name is Carol St. Hilaire. I've been your MC today. I am the board chair of My Dog is My Home, and I will be your moderator for this session. I am just going to make one housekeeping to the CPRO team, making sure that the live transcript isn't overlapping with the English translations for the videos later on. Just wanted to give that little heads up. Ok, en español, muchas gracias por quedarse aquí. Vamos a estar hablando de la salud de animal como entrada de compromiso. Mi nombre es Carol Santiler y soy la presidenta de la junta de My Dog is My Home y voy a estar aquí moderando esta sesión. Tenemos a Abby que va a estar por el chat traduciendo lo que dicen en inglés para español para ustedes. Por favor, téngannos paciencia. Hemos hecho todo lo posible para que nos puedan entender y de verdad estamos tan orgullosos de que nuestra pequeña conferencia está cruzando continentes y ha llegado a España y estamos muy interesados en lo que ustedes están haciendo allá también. All right, so again, my Spanish today, my brain, I'm really working two sides of my brain today, so we're just going to be really nice to me. So for those of you who work or have worked in homeless services, we know that sometimes people experiencing homelessness who are animal caregivers sometimes take better care of their animals than they do themselves. Their companion animal can be their only source of stability and affection. And they will do that to protect them and do everything to protect their companion animals. So this session has been developed to showcase interesting programs from here in the States and in Spain that not only serve people but also serve their animals together, and they leverage animal services as that entry point for building relationships, trust, and delivering services to the people who might otherwise be reluctant to care for their own needs for various reasons. So with us today, we have Vickie Ramirez from the Center for One Health Research at the University of Washington, Heather EDNEY from Skid Rover, Homeless Healthcare Los Angeles, and Nadia Favo and Navid Gutierrez, who are joining us all the way from Barcelona to represent Petilagun, a program of Lotura Guisa Garapeña. Presenting first is Vickie Ramirez, the University of Washington coordinator for the One Health Clinic and senior research coordinator / center manager of the UW Center for One Health Research. As a medical anthropologist, Vickie is always looking at ways to improve health access and outcomes to those communities often marginalized. She helps support and manage the One Health Clinic through outreach, evaluation, and dissemination of key findings to support other organizations who would like to use a One Health lens in critical care. Vickie, thank you so much for being here today. When you're ready, please begin.
Thank you. Thank you so much. I am going to share my screen and make sure I make the sound on. And let me just put it in slideshow view. And can you see that on full screen? Oops. Can you hear me? Okay. Unless I hear from Carol, I'm going to assume that you can see my full screen.
See you.
Okay, great. Thank you. So hello, everyone, and thank you for having me today. I'm super excited to be here. I was here at the last year's conference and met a lot of people in the chat rooms, and just really hoping that next year's will be in person so that we can see each other. And I also want to give a special thank you to Dana, Christine, and Carol for helping with the panel. And I apologize for so many versions of the slide deck that I sent you. So let's start with that apology. And then I also wanted to start with the land recognition, just for the area that I am coming from. Seattle and the One Health Clinic is on the unceded lands of the Duwamish people who still reside here today. And it's also a city mired in historical redlining and contemporary gentrification, and the housing crisis, like Dr. Brisson spoke of just about an hour ago, all of which help fuel the issues that we're all seeing in those losing homes and living in homelessness. So I'm here today to tell you a little bit about the One Health Clinic in Seattle. My name is Vickie Ramirez. I go by she, her pronouns, and I work at the Center for One Health Research at the University of Washington. But this clinic is a product of the University of Washington, as well as Washington State University's College of Veterinary Medicine, and in collaboration with Neighbor Care Health, who is the federally qualified health center that we work at a specific site in Seattle, as well as our trusted network of collaborators, because as this whole conference is talking about, the importance of working together is just immeasurable. So I'm just going to do a quick background onto what One Health is and then why we call it a One Health clinic. The concept of One Health began in the 1970s with the primary focus of looking at ways in which animal health, human health, and environment health intersect. Healthcare providers have traditionally worked in their own silos, with human health acting independently from veterinarians, and few, if any, considering the environment that their patient lives in. The aim of the general One Health lens is to look at where those intersections occur, with the idea that we cannot enact change in one of those parts, say in the human, without considering how the environment and the animals around them impact their health, and vice versa for all the different sections. One Health looks at zoonotic diseases, like those diseases that go back and forth between humans and animals, like COVID and Ebola or Lyme disease. It'll look at animals as sentinels, which is where if we see an unhealthy animal in an environment shared by humans, like in our situation over here, like the orca off the coast of Seattle and Puget Sound. If they're unhealthy, what is that saying about the health of the humans, depending on those same waterways and consuming those same salmon? So One Health also includes the benefits of the human-animal relationships. So we see examples of positive health benefits in equine therapy with neurodivergent children, or service dogs supporting veterans with PTSD. So in 2013, we asked ourselves, could we create a One Health approach for caring with persons experiencing homelessness with animals? And what would this look like? Could we create a clinic that could provide care for both the human and the animal? Could we improve the health of people and animals while always considering their environmental risks, both physical and mental, that living in homelessness or housing insecurity can cause? So when we, when we surveyed the environment or the landscape of healthcare provided to homeless populations, we saw the traditional silos of healthcare as well as variations, each with their pros and cons. So there's the traditional care model of a doctor's office or a veterinary's office that has the advantage of not having to deal with all the other variables going on in a patient's life. They can focus on the immediate concern and see patients every 10 minutes, but they may not consider the environment around the human and the role the animal plays within their lives. There is the referral care model, where a veterinary clinic has a healthcare provider or service navigator to source and schedule an owner's healthcare appointments for another location at a later date. And this model is super helpful. It provides information and resources to those who need care, but the barrier remains of the owner following through on that appointment due to whatever reason, whether it's transportation, recalling the date or time, or knowing what to do with their pet while they're receiving health services. And I'm going to take a moment here, and I'm going to interchange pet and animal only because when I was speaking with people, they were saying, that's not a pet, he's my service animal, or that's not. So I'm just going to, just forgive me those words, but those are the words I'm going to use. And I'm going to use pet ownership, even though owner is another kind of loaded term. Okay. Back to the slide. There is also the side-by-side care model, where services are provided at the same location, say at the same health fair. And this is great because the barrier of the referral system is removed. The veterinary care and the health care is in the same location. One just finishes up one point of care and goes on to the next service. But you lose in this the opportunity to share the information or create a joint healthcare plan. So what we proposed and created in 2018 was a One Health clinical care model. In this model, the veterinary and human health services are fully integrated, where vet teams and human health teams are working together on a single healthcare plan for the owner and their pet. Next slide. Where's my slide? There we go. So I usually take this time to talk about the importance of animal ownership to those experiencing homelessness, but I know you all kind of already know that. Starting in 2014, we did some formative work before we started the clinic to learn more about the human-animal bond, barriers and facilitators to housing and healthcare, as well as to learn about healthcare status and needs of owners and pets. And after listening to all the amazing speakers this week, I won't go into too much detail, but this is just my favorite quote that came out of the interviews because it seems to encapsulate everything. So one of the people I interviewed said, "I have to have her. And I think every homeless person, I think every drug addict, I think anybody that has gone through something where they think that they are at the bottom, that they don't have anything left, they need to put something first." And there are times when I was trying to quit meth over the last 2 years where I got out of bed because I knew she needed to use the bathroom. I didn't kill myself because I knew that she needed me. If you put something before yourself, oftentimes that one decision keeps you from doing the bad thing. What does the dog need today? If the dog's okay, I'll be okay. So during our conversations, we also asked participants to rate how healthy their pet was on a scale from very healthy to very unhealthy, and then how they rated their own health on that same scale. The yellow shows the stated health of the pets, and the blue shows their own stated health. The pets were reported during these times as being far healthier than their owners. And this article will be coming out next month in ANTHROPOLOGY. So we also asked them when was the last time the pets went to the vet and when they themselves last went to a human healthcare provider. Seattle has a history. There's an organization called DONI Co. Pet Clinic who's been around since 1980s, and they've been providing free vet care to low income and homeless populations for 30 plus years. So a lot of people had taken the opportunity to take their animal to the vet, but there are far less visits with the human healthcare provider. So with these tables, we figured that if we created a clinic with both vet care and human healthcare, people may come for the vet, but then end up staying for their own care. So could we leverage the positive impacts that the relationship that folks living in homelessness have with their pets, the emotional support and the physical support, and support the negative impacts animal ownership causes, including barriers to housing or services, shared zoonotic diseases, costs incurred by pet supply and food and needs? Could we leverage that relationship and create a clinic that improved the health of both the animal and the owner, and even improve the healthcare experience through a positive veterinary interaction so that there could be more openness and trust to access human healthcare? So we started the One Health Clinic in 2018. We added veterinary care every other week to an existing weekly human health clinic held at New Horizons, which is a youth and young adult enhanced shelter that allows and actually supports co-sheltering. At the clinic, we offer free preventative veterinary health care and work with trusted collaborators in the community for additional services like spay, neuter, or more in-depth needs. And we work with Naval Care Health, the federally qualified health center that provides free medical care to people experiencing homelessness in the city. The care occurs in adjacent spaces within 10 feet of each other. The clinic has a door that can be closed for privacy, but otherwise the teams can communicate to provide integrated care. As you might expect, many come to the clinic and say they do not need human healthcare. I'm just here for my dog's vaccines. And so we tell them, welcome to the One Health Clinic. We ask that you just say hi to the nurse practitioner or MD on staff. We estimate that about 80% of people come in and say they don't need healthcare for themselves. But with the just say hi requirement and Neighbor Care Health's ability to connect with clients, about 80% of those end up in a clinical visit that day. If they don't come back that day, they may come back to another clinic on a future date, or tell someone they know what services Neighbor Care Health provides. But what we do know for a fact is that Neighbor Care Health patient load increased by 42% since adding free veterinary care to the clinic. They also increased human healthcare follow-ups by 18%, and that occurs even on the off weeks when there's no veterinary care. The shelter, New Horizons Shelter, is happy to have this service available for their existing clients, as it also brings youth and young adults to the shelter who may not have otherwise accessed human services that they provide, such as case managers, housing support, access to the Apple Care program, emergency and transitional housing, and they can use that opportunity to engage. So strengths of integrated human health and veterinary care include the fact that veterinarians are a trusted profession. And we have seen people engaging with healthcare because it ends up being a safe space. And in these safe spaces, clients may offer information to their veterinarians not shared with the human healthcare provider. For example, one client came in with a kitten that they were concerned about because the kitten had been thrown. Because of this information, we were able to connect them immediately to the healthcare team to talk about domestic violence concerns. Veterinarians may also be more aware of environmental health hazards and shared risks, and treating the pair jointly can highlight shared environmental exposures. An example of this is where a human patient attended clinic while pregnant. She took her cats immediately after her human health visit and talked about how they had been catching rats recently. So we were immediately able to educate about toxoplasmosis and the risk for the fetus. Other strengths of having an integrated clinic includes having the human healthcare on site to easily connect pet owners with human healthcare services. We had a case where a ferret came into the clinic looking awful. I really didn't think he was going to make it. The ferret was diagnosed with the flu, and it's the same type of influenza virus that affects humans. The nurse practitioner was able to meet with the owner, who was then also diagnosed with the flu. And then a joint healthcare plan can be made easily as well. We had a patient whose dog was diagnosed with cancer and had considerable pain and was in need of pain medication, while the owner had recently become clean, and the health teams were able to work together to create a pain management plan for the dog that wouldn't affect the owner's sobriety. The One Health Clinic in Seattle is also a teaching clinic for students from medical, veterinary, nursing, and social work, nutrition, public health, and other health sciences. The clinic provides an interprofessional learning opportunity, as well as the opportunity to work with a demographic of client and patient that they may not have otherwise provided care for. Among with a myriad of other skills, at the clinic, you have veterinarians learning about trauma-informed care and human health sciences students learning about the benefits of the human-animal bond. We are also working to include more peer educator opportunities where youth and young adults can be trained in aspects of animal and human health so they can report back to their peers. And honestly, this clinic is just fun. We spend a lot of the time on the floor, like Dr. Katie Kuhl here, with the patients. We take the time needed to create that positive healthcare experience, and we take the time to validate that relationship that they have with their pet and give the owners agency in their animal's care. The time the vet team takes helps establish roots in a positive healthcare experience, which may help that owner feel safe enough to access their own healthcare. We continue to impress the importance of good health at both ends of the leash. And there are always opportunities to further reduce barriers, which we do through our amazing network of trusted providers. Because, we do everything far better when we do it together. So clients needed pet food and supplies, which we get from nonprofits like Seattle Dogs Homeless Program and Beloveds. Clients have asked for grooming, which we were able to incorporate pre-COVID using a mobile groomer volunteering her time. Clients also asked for behavioral services and dog training. We started having a dog behaviorist and trainer from Upward Dog volunteering to come to clinic and work in tandem with the human and veterinary care providers and helping with training. The response was so positive that we are doing a pilot research study now. The study is an 8-week dog parkour intervention co-taught by the behaviorist and trainer and a human mental health provider. Each training day introduces new skills for the dog with a matching complementary human mental health skill. For example, if today's dog lesson is going under and over a barrier, the human mental health skill will be addressing barriers in life. Now I'm going to show you a video, and the duo in this video already had a great relationship coming in. So we can't take 100% credit for this, but the training has really improved their communication, leading to less frustration by the owner and less anxiety from the dog from not understanding what is expected of her. So I'm hoping this works.
2 feet. Hey. 2 feet. 2 feet. 2 feet. Tunnel. 4 feet. 4 feet. Over. Over. Grab. Hey, grab. Good job. Spin. Come here. Spin. Tunnel. Hey. Hey. Tunnel. Shake. 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 Up.
So I just love that. They're doing great. It's a really fun project. Whoops. All right, so lessons learned that we've learned from the One Health Clinic from over almost 4 years that we've been doing it includes the idea that having free veterinary healthcare gets people in the door, and having other service integrated into the system increases participation in all services. Treating the human animal as the unit they are improves the healthcare of both. Training students in all the human and animal health sciences to work together across disciplines, as well as with this community, creates better providers with both increased empathy and skills. The data that we look at are showing quantifiable benefits to this model of care, and that the One Health Clinic model has interest from organizations around the world. We were getting contacted from other states and countries that had heard about this clinic, and we're looking at ways to replicate the model. So we took the opportunity to create a free toolkit that walks people through the process. It starts from the very beginning of the process, including what to consider, the decisions you need to make, the people and organizations to connect with, all the way through clinic day, including forms and setup. We have monthly meetings to connect with people and organizations working towards clinics in their communities to troubleshoot issues that come up, and have an opportunity for Q&A where everyone contributes their experiences. We currently are working with a number of communities internationally to help create clinics in their own communities. Our next meeting happens to be on Tuesday, next Tuesday, March 8th at 2:30 Pacific, and we would love to have you. And if you are interested in starting a One Health Clinic or just want to connect, here are some links, and I'll drop them into the chat after I'm done here. And more links that I'll also link, and we can wait till the end for question and answers. Thank you.
This is so awesome. Please come to New Jersey.
Absolutely.
This was great, Vicki. Thank you so much. The work you're doing at Center for One Health Research is amazing. So for people who just joined us, this is the animal health as an entry point for engagement session. If you're looking for Zoom Room A, please hover over your menu bar in Zoom and click breakout rooms icon. So Zoom Room A is the other session, and we're doing this session in this main room. Our next presenter is Heather EDNEY, as Executive Director of the 4th Authorized Syringe Exchange Program in the United States. Heather EDNEY has more than 3 decades of experience as a community organizer and leader in developing and implementing groundbreaking harm reduction services for people who use drugs. She is a founding member of the National Harm Reduction Coalition and the North American Syringe Exchange Network. With her own compelling story of recovery, Heather is a tireless advocate, both professionally and personally, for the needs of people who use drugs. Her dedication to ensuring programs and services are more accessible and responsive to the need of women, young people, and the LGBTQI community has transformed the many programs that she has championed. In 2013, the Obama administration invited EDNEY to serve as a member of the SAMHSA Opioid Dose Prevention Working Group, which led the first federal research promoting overdose prevention. Most recently, she worked with the National Association of State and Territorial AIDS Directors to develop Bevel Up, a resource for health departments running or supporting syringe service programs. Funded by the CDC, this educational resource is the first of its kind, with updated harm reduction strategies specific to fentanyl. In her role as Communications and Development Director at Homeless Health Care Los Angeles, EDNEY founded Skid Rover, a program that distributes dog food and supplies to people with pets living in Skid Row. Thank you for joining us, Heather. Harm reduction is such an important principle and practice, and we are thrilled to have you to learn about how this work intersects with homelessness and animal companionship. Whenever you're ready, please begin. Thank you.
Thank you so much. I also want to thank the conference organizers for hanging tight and asking me to be here today. It's really an honor. So I'm going to start by showing a video. It's something that we made for our donors, and then I'll do a quick presentation. Skid Rover is merely providing items that the people that we serve have told us that they want and they need.
At Skid Row, we offer everything for a pet, and not only dogs but cats. We offer dog leashes, flea medication, dry food and canned food, bowls so they can eat, clothing. We offer anything just like a pet store, we have.
It changed my life because I know this guy need me now, and I think I need these guys too. It's my friends. I'm living here 33 years without family. But after 33 years, you know, I feel like I need something. I feel like I need somebody with me. You know, somebody give me support. I give support to this guy gives support to me. That's a good to have a pet. You have it some places, it give you support. You know what I mean? I appreciate that.
Their dogs are their babies, they're their everything. So they're being forced to make this decision about, do I feed myself, do I feed my dog? And all the time we hear people feed their dogs before they feed themselves. If we're able to provide dog food, then they don't have to make that choice.
So we even have some clients that they've been refused housing because they have their pets and they will not let loose of their pets to get housed. And I understand because a pet is important.
It's my dog. I love my baby, man. She keep me going. Like I said, we're living in a tent, so it motivates me to get up and try to do something different, better for both of us.
I've seen how our clients taking care of their animals has also been a direct liaison for them to take care of them and their well-being.
She keeps me going through the day. You know, especially like those times that I want to give up and just say forget it. She keep me going.
I think people need to open up their eyes and realize that these are human beings and human beings with pets. Just like you love your pet at home, they love their pets here. So we need more donations, we need more dog food, we need more cat food. We need everything that your dog could possibly have, we need it.
All right. So next slide, please. So homeless healthcare has been around for 30 years, over 30 years. And that's not when we serve over 100,000 people a year, not 1,000 people. We see a lot of people. We have a collaboratively run hygiene center in Skid Row. It's open 24/7, showers, laundry, restrooms, and dogs. It's like an outdoor area, but you know, with covering, and so people can come in. There's a place where you can charge your phone, get clean drinking water, do your laundry, use the restroom, blah blah blah. Get supplies for your dog and hang out. We also have a syringe exchange program right around the corner. It's also in Skid Row. And that is another place where people can come get health care. We have a medical doctor who works there who lances and drains abscesses. So she does low threshold wound care. And we also have opioid, MAT, which is the drugs you take to get off of opioids. And we do encampment outreach. So homeless healthcare does a lot of different things. Next slide, please. We're based on the harm reduction model. There's no barrier to entry. That means people bring their pets when they access services. And next slide, please. Oh, evidence. People with their pets accessing services. Next slide. Okay, so back to that medical doctor. So one day, so I've been doing this work for a long time. I'm the fundraiser. I don't do direct service necessarily, but I am in the mix because I like to be in the mix. So one day I was talking to the medical director and I was like, what are the people that you are seeing need? And she said, well, a lot of the people we see here, their dogs get hit by cars because they don't have collars and leashes. I was like, that's easy. I know like a gazillion dog owners who have like extra supplies. So I just started gathering stuff. Other staff members started doing that. We called it hashtag Pets of Skid Row. Luckily, through like some divine intervention, we came up with Skid Rover, and which kind of just like says it all. And so really what, homeless healthcare is a people organization. And this is like my side hustle within the organization. But what's amazing is that it's like one of the most requested services by our clients because obviously it's something that's important. It's collars, leashes, and dog food. Next slide, please. Okay, so I guess there was not a lot of buy-in initially when I brought up this idea. And so I got this friend of mine who's like a fashion photographer to come to Skid Row, and we took photographs of our clients and their dogs. Next slide, please. And it was an amazing experience. Everybody got their dogs like dolled up. They got dolled up, and he took these gorgeous photographs. And I got one piece of like kind of effed up feedback, which was like, oh, well, they don't like homeless. And, so that to me says a lot right there that we have a long way to go in educating people and just like around stigma. Okay, I'll come back to that in a second. So these people are all Skid Rover MVPs. I want to just pause for 1 second and say the woman in the bottom left-hand corner, she just died. Her name's Heather. That's her dog, Bubba Barks. And she just died of an overdose. And before she died, she, because she knew she was at risk for overdosing, she arranged with somebody else to take care of Bubba Barks if something ever happened to her. And in the same way that we hear people say, we've heard this over the past 3 days, people don't get care because they can't bring their dog. People won't go into housing because they can't bring their dog. People also think about what's going to happen to their dog if something happens to them, just like everybody, house, no house. And so to me, this is like a photo gallery of heroes. Everybody here has rescued a dog, right? And yeah, anyways, I know you guys already know all this, but next slide, please. Okay, so here's what we did. I realized that I had to hustle up like money to pay for the dog supplies because, again, I didn't have a lot of buy-in in the beginning from our organization. I just don't think people thought anything was going to happen, like that we were going to get any traction with this. But what I found out is that there's a lot of people out there, as you guys know, who are really into their dogs. And there's a lot of dog influencers. And there's just a whole world out there on social media of people who care deeply about pets. So we had a fundraiser called the Yappy Hour. Next slide. What ended up happening was all of these dog influencers showed up to our event. We didn't know them. We are a nonprofit, like that's not our wheelhouse, but somehow they found out about it. They came. Next slide, please. And they were a hit. We raised a lot of money. It helped us to buy more dog food. And the best part about this is that it was an entry point for donors to explain to them that it's great that they care about the dogs how can we like work with them on their continuum to help them understand the importance of helping or caring about people. And so, you know, I don't feel like we need to incentivize or manipulate our clients into coming to get services. They're like, they have their own autonomy. They know what they want and they need. But who we do have to convince are like, is the general public. And so in the research panel earlier, somebody said like, how are we going to get everyone together and make the change? And like, this is how, in my opinion, we're going to make the change, is by tapping into these micro communities that I mean, some of these people care about homeless people, but most of them don't. I mean, most of them care a lot about dogs. And yeah, it was an unintended consequence of Skid Rover, but it's proven to be very effective. And I think that, you know, if you are a social service agency and this whole topic is feeling overwhelming, it can be as simple as getting leashes, getting collars, getting dog food, getting it donated, and just giving it out when people are coming to get their other services. And it's not like a big deal in the meta, and I know that we have gigantic problems we have to solve, but any day somebody does not have to worry about their baby eating is like a total victory as far as I'm concerned. And any day someone doesn't have to make a decision about whether they eat or their dog eats, again, victory, you know? And so it's also like a way of really telling the people that you have the honor to serve, like, I get you, I see you, I know what's important to you. You're not just like a public health, you know, problem, you know, because of COVID, or a vector for HIV because of you shoot drugs. Like, you are a person who has like this little fluff ball that you love, and we just want to, like, you know, be a bright spot in your day, and by recognizing how important that is and providing whatever supplies we can scrape together. So I think that's it. Next slide. I think that was the last one. Oh, well, okay. Sorry for the soapbox thing. I just like, I can't help it. These two puppies, they had just been rescued from a dumpster. This was our first day we like launched Skid Rover, and we like, you know, just took pictures of people with their dogs before we got the fashion photographer and all that. And like, this woman works at the refresh spot. She still has the two dogs. We all got a crash course in like puppy care, you know, like going to get the bottle drop, you know, like we're like, again, we know we're not dog people. There are badass organizations in Skid Row providing services for people with pets. We're like just providing the services for people who are people. So we do the best we can, but yeah, I don't know where I was gonna go with that, but like, I guess like we're like the needle exchange of pet care in Skid Row, and that's important. So next slide, please. I think that was the last. Yeah, that's it. That's my contact info, and thanks again to the conference organizers for asking me to participate.
Thank you so much, Heather. This is amazing. For those who might not know, My Dog is My Home was founded because of experiences our founder had while working on Skid Row. So we know how much of a need there is for the work that you're doing through Skid Rover over there. Thank you so much for sharing this. So if any folks are new here, this is the Animal Health as an entry point for engagement session. If you're looking for Zoom Room A, please hover over your menu bar and click the breakout rooms icon. So presenting next, all the way from Barcelona, are our friends from Locura Guisa Peña, Nadia Favo and Nadir Gutierrez. The Lotura Cooperative was born in 2020 in San Sebastián, Donostia, in Spain, from social entrepreneurship, from a commitment to develop innovative proposals and really to a way to enhance the agency of citizens. So how could they get citizens involved in caring? As a starting point, they developed the Nuzi Voz Calea program, Nadir and Nadia me lo pueden corregir, which was a citizen participation program where, in addition to raising awareness, participants made proposals to improve the quality of life of people in situation of homelessness. And finally, their objective was to present these proposals to the local government administration. And from there, the VICKIE Lagoon program was born. I would like to note for our audience members, our special guest speaks Spanish. So there has been a lot of translation work happening before today, after today, during. I again shout out to Abby, who has been translating in the chat box. So we're gonna have, when we do the Q&A at the end for all of our presenters, including Nadia and Navid, there's just gonna be some live translating. Their slide deck, which is in English, is gonna be popped into the chat. And we're gonna watch their videos with English subtitles. So their videos are in Spanish. Nadia y Nadir, muchísimas gracias por estar con nosotros. Estamos súper agradecidas de que están aquí. Sé que ya es tarde y let's get the video up.
Hola, ¿qué tal? Bueno, muchas gracias por invitarnos a dar esta charla. Vamos a estar mi compañera Nadir y yo. Somos parte del equipo de Lotura Gizagarapena. Somos una cooperativa pequeña de iniciativa social y bueno, la conformamos hace poquito, hace prácticamente 2 años, con una idea muy clara, que era hacer cosas diferentes. No seguir y la exclusión social. Uno de los primeros programas que desarrollamos con ese nuevo matiz de la innovación social fue un programa de participación ciudadana que se llamó Nagusi Voz Kalean y que perseguía, poner en contacto a las personas mayores del municipio de Donostia, San Sebastián, acercarles a la realidad del sinhogarismo. Por medio de diferentes metodologías, tenían que, primero investigar o un poco, quizás también cambiar la mirada sobre qué entendían ellos sobre el sinhogar. A partir de ese acercamiento, se dieron cuenta, se percataron de diferentes soluciones que podían ellos idear para mejorar la calidad de vida de las personas que vivían en calle. Una de esas ideas brillantes y creativas fue el programa que os presentamos, que es el VICKIE Lagoon. Porque, se dieron cuenta y observaron que muchas de las personas que vivían en calle estaban acompañadas por sus animales de compañía, en general perros, y que de alguna manera ahí estaba el germen de algún programa que les podía beneficiar y les podía aligerar un poquito su día a día. Bien, dentro de este grupo de participación ciudadana, crearon la semilla del VICKIE Lagoon y desde Lotura Gizagarapena empezamos a darle forma. Y el primer hilo que tiramos de ese ovillo fue, contactar con, primero era un grupito de 3-4 veterinarios que les conocíamos por otras razones, y sí que vieron viable la posibilidad de crear una pequeñita red de clínicas veterinarias que atendiesen a los animales de compañía de las personas sin hogar que de alguna manera pasaban por la entidad, por Lotura, por nuestro programa de Vetilagun. Nadir es la técnico referente del mismo, entonces lo que perseguíamos era intervenir socioeducativamente con las personas sin hogar a través del cuidado veterinario de sus animales de compañía. Es decir, el cuidado de sus animales para nosotras suponía no un fin en sí mismo, sino un medio para poder intervenir con las personas sin hogar. Y se creó una red bastante importante de clínicas. Estamos alrededor de 13 clínicas veterinarias adheridas al Vetilagun en estos momentos. Y bueno, con idea de ampliar esa pequeña red. De manera paralela y un poco siguiendo nuestra ansia de sensibilización y de participación ciudadana, una vez que teníamos creada la red de clínicas veterinarias, surgió la posibilidad de crear otra pequeña red de casas de acogida, de ciudadanos y ciudadanas que de alguna manera se querían hacer cargo de esos animales cuando las personas, sus dueños o sus dueñas, no tenían posibilidad de atenderles, por las razones que fueran, o bien por enfermedad, por un ingreso hospitalario, por diferentes casuísticas. Y hemos creado una pequeñita red de casas de acogida. Normalmente son personas cercanas a las personas que ya conocen, que están en situación de calle y que de alguna manera ya hay un pequeñito vínculo. Por lo tanto, el que ese animal se quede en esa casa, no es tan agresivo ni tan, tan frío como pudiera ser ejecutarlo de otra manera. El Vetilagun ya lleva un año de andadura, este es el segundo año que lo desarrollamos y es un programa que ha ido brillando poco a poco y en esa, en ese ansia de sensibilización y que el Vetilagun se fuera haciendo más grande, contactamos también con un crematorio de animales de aquí del municipio para, porque también hay muertes de animales y queríamos ofrecer a las personas que estaban en calle, un final digno también para sus animales de compañía. Entonces, este crematorio también ha firmado un convenio con nosotras para hacerse cargo de este final de los animales, ¿no? Y las personas sin hogar pudieran despedirse de una manera un poquito más dulce. Vale, también hemos tenido el apoyo del resto de entidades sociales que trabajan aquí en el municipio para de alguna manera o bien derivarnos casos o facilitarnos o ir de la mano con nosotras en determinados casos que requerían la intervención de Nadir, de la compañera, y porque había un animal de compañía al cual había que atender. No podemos no comentar el papel tan importante que ha tenido la administración en Vetilagun, tanto porque hemos recibido subvenciones a nivel foral y también a nivel municipal. Pero no solo ha habido un pequeñito impulso económico, sino en concreto el Departamento de Salud Pública y Bienestar Animal del Ayuntamiento de Donosti ha conseguido tejer con nosotras una serie de convenios y de protocolos de actuación donde sí que hemos ido de la mano tanto en lo social como en lo sanitario, se podría decir. La técnico del Departamento de Bienestar Animal se encargaba un poquito del aspecto veterinario Y Nadir en este caso, Betty Lagoon, Lotura, lo que hacíamos era bueno, ir de la mano con esta parte veterinaria y extraer y hacer brillar un poco la parte social, intervenir también con la persona que está en situación de calle. Entonces, bueno, ha sido sumamente beneficioso el ir de la mano, ¿no? Al final, una entidad social y la administración, creo que es un ejemplo de buenas prácticas y en concreto, bueno, pues la técnica supo ver lo beneficioso de respetar el vínculo entre la persona propietaria y el animal, ¿no? Y a partir de creer en ese vínculo y respetarlo, pues han podido hacer muchas intervenciones y que han salido realmente bien.
Now, Nadir.
Hola, muy buenas a todos y a todas. Yo soy Nadir Gutiérrez, soy la técnica referente del programa Vetilago. Antes que nada me gustaría darles las gracias a toda la organización por el espacio de participación y de socialización de la experiencia Vetilago, que esperemos que sea de vuestro interés. Siguiendo un poco a lo que ya os comentaba mi compañera Nadia, en cuanto a lo que fue la buena práctica y relación junto con el Departamento de Bienestar, de Salud Pública y Bienestar Animal del Ayuntamiento de Donosti y el programa Vetilago, pues decir que en este trabajo en conjunto principalmente acabamos pudiendo desarrollar y sistematizar un protocolo de actuaciones junto con otros agentes del municipio como la Guardia Municipal, el Servicio Municipal de Urgencias y la Asociación Protectora de Plantas y Animales de Guipúzcoa. En este protocolo nuestro principal objetivo era poder homogeneizar una serie de intervenciones que vayan en la línea de reducir conflictos y minimizar sanciones y sobre todo garantizar escenarios de bienestar y garantías mínimas sociosanitarias tanto para las personas como para los animales de compañía. Por otro lado, este departamento acabó desarrollando un canal de facilitación y al mismo tiempo un puente entre la administración, que es como un mundo que va totalmente diferente a lo mejor de lo que podría ser un trabajo más desde calle o a pie de calle, y sin embargo pudimos encontrar ese punto de sinergia y de conexión. Al mismo tiempo de facilitar contactos, recursos, coordinar, actualizar, socializar. O sea, realmente fue como se pudo converger las dos miradas para trabajar en un mismo sentido, ¿no? Y bueno, de este trabajo conseguimos iniciar un proceso de actualización de los requisitos de acceso a los centros de acogida nocturna, así como su adecuación de los espacios, ¿no?, para los animales de compañía. Entonces es un granito, al final entendemos de que la incidencia en la administración pública lleva su tiempo, pero el simple hecho que desde un departamento que no tiene nada que ver con el área de la acción social se haya podido intervenir en estos espacios, priorizando el bienestar y el vínculo positivo entre la persona y el animal, pues resaltamos que ha sido algo totalmente positivo. Y bueno, por otro lado, en cuanto a lo que tiene que ver la metodología específica de este programa, resaltar que nuestras líneas básicas de trabajo fueron la baja exigencia, la flexibilidad y la apuesta por un trabajo desde la cercanía y en medio abierto. Esta manera y esta mirada de poder trabajar y acercarse hacia las personas a través del cuidado de sus propios animales acabó fortaleciendo y abriendo, y acortando sobre todo los tiempos y espacios para poder fortalecer un vínculo tanto por mi persona como por las personas que tienen los animales y que se encuentran en esta situación de exclusión residencial grave. Así que pues en el desarrollo del programa del año pasado participaron un total de 33 personas y 56 animales. He de resaltar de que el programa en sí comienza siendo un programa pionero a nivel de la comunidad autónoma vasca, donde pues bueno, se partía de una inexistencia de datos, de un censo de cuántas personas se pueden encontrar en situación de calle con animales de compañía, y al mismo tiempo personas que se encuentran en situación de exclusión residencial que tienen una alternativa habitacional, o sea, tienen o tuvieron animales, ya que muchas de estas personas tuvieron que tener una separación forzosa, ¿no?, para poder aceptar estos recursos habitacionales de la administración. Sin embargo, pese a esta incertidumbre de datos y de escenarios a los que nos íbamos a enfrentar, pues el programa tuvo muy buena acogida, tanto por ya las entidades que sí estaban bastante sensibilizadas y porque ya venían, o sea, viendo el problema hace mucho tiempo atrás, como por la Administración de Salud Pública y Bienestar Animal y por los mismos participantes beneficiarios del programa, ya que fueron estos los principales portavoces y también socializadores del programa, ¿no? Así que me gustaría poder ahora centrarme en las tres líneas de trabajo que giraron en torno a nuestras intervenciones, que sería la línea más sociosanitaria, la línea socioeducativa y la de acompañamiento psicosocial. En la línea socioeducativa, principalmente nuestra función fue poder promocionar e informar de los recursos existentes y de los servicios que había en los municipios, así como de poder realizar derivaciones y al mismo tiempo poder acercar a las personas con los animales a estos recursos, ¿no? Y bueno, acompañar en temas de procesos de mejora, acompañamientos en adquisición del padrón social, etcétera. Por otro lado, lo que tiene que ver con la línea más de apoyo psicosocial, giraron principalmente en torno al acompañamiento en el duelo. En el duelo, ya que tuvimos tres fallecimientos de 3 animales el año pasado, entonces claro, el poder acompañar a estas personas en un proceso de desapego, pérdida, y donde al mismo tiempo varias estructuras del cotidiano de estas personas se iban cayendo, agravando sus episodios de soledad, sus espacios de socialización, y al mismo también pues se veía también un mayor aumento de sus consumos de sustancias. Así que bueno, la idea era poder trabajar desde una manera más preventiva. Y bueno, en cuanto a lo que es la línea más sociosanitaria, nuestro trabajo dentro de lo que es el cuidado de los animales de compañía, en coordinación con las clínicas veterinarias, giraban en torno a lo que es la desparasitación interna, las vacunas obligatorias, la antirrábica, las cartillas de identificación y los microchips. Sobre todo para poder garantizar como los mínimos que exige la normativa de tenencia animal, y al mismo tiempo poder también como abrir los espacios como de consulta veterinaria como espacios de relación y de encuentro entre un personal veterinario y estas personas, ya que son como dos mundos que a lo mejor podrían estar paralelos o no podrían encontrarse, pero partiendo de una sensibilización que recibieron los profesionales veterinarios, pues las citas veterinarias llegaban a ser como unos encuentros más cuidadosos, más sensibles con los temas, y bueno, acabó también como generando muy buena relación entre el profesional veterinario y las personas que participaban del programa Vetilago. Y bueno, todo esto se veía manifestado en el proceso, ¿no?, de acudir a la cita antes y después así como también como en el cumplimiento y la responsabilización de las pautas de cuidado o toma de medicación de los animales. Y bueno, ya un poco para finalizar, me gustaría compartir con todas y todos las líneas a futuro que tenemos pensado poder desarrollar en este año, en este 2022, que girarían en torno a poder enfocarnos debido a las grandes demandas que nos llegaron en la línea de la atención y el cuidado de los animales de compañía de mujeres víctimas de violencia de género, y cómo también pues está de una forma u otra vinculado al acceso, ¿no? y la permisidad de los animales de compañía en los centros de acogida y de protección para las mujeres. Así que bueno, es un trabajo que como viene ya por otra esfera de la administración, pues esperemos que este año vayamos pues también indagando y poder abriendo nuevos canales para poder realizar una incidencia, así como también no dejar atrás lo que ya comenzamos realizando en el Ayuntamiento de Donosti. Vemos que hay una disponibilidad por parte de la administración, también hay una visión clara por parte del personal técnico, así que sumando un poco estos ingredientes, esperemos que este año se pueda, vehiculizar y al mismo tiempo pues conseguir esta nueva actualización de requisitos de acceso, así como el acondicionamiento de los espacios para los animales. Y bueno, ya finalizando por tema de tiempos, si tienen alguna duda, ya dejarlo para el momento de las preguntas y darles las gracias por su atención y su tiempo. Un saludo.
That worked. I hope everyone enjoyed that. Gracias a Nadia y a Nadir. Nos encanta escuchar sobre innovación en todo el mundo. Están al otro lado del mundo de nosotros, pero algunas de las cosas son universales. La gente necesita hogares y la gente ama a sus animales. So thank you, Nadia and Nadir. We love hearing about the innovation all over the world. You might be located halfway around the world, but some things are just universal. People need homes and people love their animals. So now we're going to enter into our Q&A portion. We have a few minutes for some questions. So put them in the chat. I know that there have been lots of conversations. If anything didn't translate well, feel free to put it in the chat and Abby and I will get to it. So I'm going to start off with Vickie. Your clinics really seem to raise the bar of what One Health clinics can offer people. That's not because other clinics don't want to offer more human services, but it might be a resource or a relationship gap. What advice can you give to other groups who are delivering street medicine, perhaps in a more grassroots way, to get buy-in from human health and human services for participation?
Yeah, I would say that it's the human side that's the hardest to bring in. And so that's why we kind of created that toolkit and why we're meeting with organizations monthly, because we're offering our services to be that point of contact, coming from the University of Washington, coming from the School of Public Medicine, coming from a center that is led by MD. We have the voice to be able to communicate with other healthcare providers. That kind of gives that little push to get them to understand that there is a really high value for their own clientele and own patient load if they kind of adopt that model. From the grassroots, like this One Health clinic, we're doing it right now out of a few sites in Seattle, but it's not the One Health clinic. It's like anyone can create a One Health clinic in their model with any varying level of mobility or brick and mortar or whatever kind of what you have. We offer in those meetings, we offer like connections to people that we know. So it's a lot of network building, because what's really important is that we are not doing something alone. The School of College of Vet Medicine isn't doing all the work, and UW is not doing all the work, and it's everyone coming together to bring their resources together. So it's all about communication and network and buy-in. I don't know if that answers the question.
Yeah. And our friends in Spain, I'm wondering if we could either put in the link to the toolkit or
Yep.
tell them where to go. You speak some Spanish, Vicky
I speak
Ramirez.
Spanish, and we can set up a meeting. My Spanish is awful, so I'm not even going to try here. But we can set up a meeting having a proper person and just go through the toolkit and explain
Great.
everything. Please translate that.
So Nadia, ella dice que en otro momento podemos hacer una reunión con Vicky y le damos podemos ver su conjunto de herramientas, perdón, que esa es la mejor traducción que pude conseguir. And Abby is giving me some help there in the translations as well. For Heather, I mean, I feel like with the Biden crack pipes a few weeks ago, this is just like perfect opportunity to have these conversations. I wanted to pull my hair out. Unfortunately, harm reduction is still so controversial. Through Skid Rover, you were working with a very stigmatized population. My English is not going to be bad. People experiencing homelessness who use substances and also have companion animals. How do you build support for such a program? And do you have any advice for others who want to start similar programs within communities that may have less progressive values? Like I know you said people might not care about the homeless folks, but everyone loves animals. But sometimes what I've seen is like, oh, well, if they can't take care of themselves and they're using drugs, just shouldn't have animals. I need to save the animal from that horrible person.
I am so glad you asked that because I happen to know that Diana is at this session. And okay, so two things. One is I mean, I don't know. You could have a house, drink alcohol every night, abuse your dog, and then you could smoke fentanyl, live in a tent, and love your dog. I guess it's, we just have to just kind of keep trying to explain that to people that they're crazy and they need to recalibrate because it's so hypocritical. And then the other thing I would say is this woman, this dog influencer stole one of our clients' dogs, and Diana from Heart LA, who is a fierce attorney and just human being, fought to get this person's dog back. And the woman who stole his dog was an influencer. She's raising money for stolen dogs. They steal people who are living on the streets dogs, and then they do these little GoFundMe campaigns and stuff. But she's an idiot and did it all wrong. So Deanna's going after her, which is exciting. But what's horrible is that his dog died while in the care of somebody else. So what's my point? We have so much work to do, I guess. I don't even know what to say. And as far as, the drug users not taking care of their dog, I mean, they do, people just do. And that's a generalization, just like all of it is, but.
Can I jump in for a second? Can I follow up on that?
Yeah.
We're always looking at ways to explain things to the housed community. It's a constant battle. And a project that we did a photo voice story where we gave folks cameras, they took their own pictures, they told their own stories, and we did gallery pop-ups around town just to really kind of put a point across of what animals mean to them. But I'm wondering if we can put it in that, it's always a storytelling to convince someone that someone who is using would be a good parent. It'd be nice to have some kind of storyline like that.
I just remember my main point too. Sorry, I'm passing out.
Don't worry about it.
Red Bull. Okay, so the people that we see at the needle exchange especially, but also at the Refresh Spot, they are not accessing other services, right? They're high acuity, and they don't get treated well when they access other services. So we might be one of the only places that they come. And so we really, really need to like bring our A game and provide as much as we can while people are there. And yeah, I don't know. That's all I wanted to say about that.
No, it's definitely been it's a conversation to have. Para nadie y para Nadir, la naturaleza interdisciplinaria de su trabajo y la participación del gobierno es muy impresionante. Según nuestra experiencia, los gobiernos suelen ser los últimos en aceptar la importancia de servir a esta población. ¿Cuál fue la fuerza impulsora detrás de que ellos quisieran hacer algo para tratar de ayudar a esta gente en la calle? I'm going to type the question in English for folks to see. Yeah. Nadie está, las dos están en mute. I don't know how to say unmute.
Vale.
Ya, perfecto.
Bueno, contesto yo y si quiere Nadir matizar algo y también contesto una preguntita que han lanzado en el chat, pero no me ha dado tiempo a contestar. Bueno, yo creo que una de las razones por las cuales la administración lanzó o impulsó el programa es porque casi no hay programas diferentes o innovadores para las personas sin hogar. O sea, la apuesta desde la administración es muy pequeña. De hecho, el impulso económico ha sido realmente pequeño, pero bueno, había que empezar de alguna manera, ¿vale? Y luego porque es una metodología que hasta ahora no existía, por lo menos aquí en el municipio donde nosotras vivimos y donde desarrollamos el programa. Entonces, se unían varias cosas. Hacía mucho tiempo que ninguna entidad social hacía nada nuevo para las personas sin hogar, ¿vale? Estaban los recursos de siempre, estamos los técnicos de siempre haciendo lo de siempre, ¿vale? Que eso es un poco el principio de mi vídeo, ¿no? Donde de repente, pues eso, después de 20 años haciendo lo mismo, surgimos como lotura para hacer algo diferente. Entonces eso la administración, pues bueno, pues lo apoya, ¿no? Y hacerlo de manera diferente a través de una red de clínicas veterinarias. Eso también, bueno, esa parte de la innovación sí que atrajo a la administración, porque ha sido hacer emparejamientos, ¿no? De veterinarios que en principio es una profesión que no tiene nada que ver con lo social. Y estos emparejamientos raros o diferentes, pues también ha provocado cierta curiosidad hacia el Vetilagun, ¿no? Y luego, claro, eso se transmite en la sensibilización ciudadana, porque nosotros nos hemos encargado de sensibilizar a los veterinarios sobre la realidad de la exclusión social, que no tenían ni idea, ¿no? Entonces, bueno, ha habido ahí un max mix de variables, una combinación, un cóctel de variables que ha hecho que Vetilagun, bueno, pues sea apoyado por la administración. Hay otra pregunta que me han hecho, que aquí los recursos habilitados para las mujeres víctimas de violencia machista son recursos que puestos por la administración. Y esos recursos tienen unos requisitos de acceso. En esos requisitos de acceso ahora mismo no están permitidos la tenencia de animales de compañía. Entonces, bueno, dentro de los objetivos de Vetilagun está cambiar esos requisitos, por un lado, y como plan B, ofertar esta red de casas de acogida que hemos comentado antes como apoyo para que mujeres, eso también hay un estudio hecho en Barcelona, que muchas mujeres son reticentes a salir de la vivienda en la cual sufren maltrato porque no tienen dónde dejar a la mascota, porque en los recursos que les ofrece la administración no se les permite entrar con esa mascota. Entonces, al ofrecer una casa de acogida donde la mujer, de una manera como más cordial y más dulce, pueda dejar a la mascota con la cual tener relaciones bueno, pues a través de una persona referente o tal, bueno, hace que esa mujer salga de su domicilio donde está sufriendo maltrato de una forma más rápida y más segura. No sé si he respondido.
Gracias, no, los respondiste. Y yo y Abby estamos ahí poniéndolo en inglés. So, folks, Abby and I are doing our best to directly translate. Excuse my typos. Nadir, ¿quieres agregar algo? And kudos to Nadir, who did that video when she was sick with COVID. Her and I have been texting almost daily, and she was sick as a dog and was, did this for us. So, mil gracias, Nadir, que estabas enferma y nos grabaste ese video.
Bueno, pues nada, un poco complementando lo que ya decía Nadia, en cuanto a lo que fue también como la relación con, bueno, lo más exitoso para resaltar del programa es esa participación que hubo por parte de los veterinarios. Es que en realidad eso es gente que al final, de una forma u otra, sí que estaba relacionada con gente que está en exclusión social, que tiene animales de compañía, pero que, bueno, nunca hubo ese match, ¿no?, que hablábamos. Y sin embargo se pudo dar ese juego y poder unir todo en este programa, unir la parte esta veterinaria con una visión más social. Y luego, complementando ya lo que decía el tema de violencia de género, bueno, según estudios que hay aquí, en realidad las mujeres víctimas de violencia de género demoran de media 4 años más en poner una denuncia que otra que no tiene animales de compañía. Entonces,
I wanted to translate this piece because she says they did some studies, and a person experiencing a DV situation will wait 4 more years, and if they have an animal, they won't report it for 4 years more than a person who is in a DV situation without a pet. So really, they were able to see that this is a need with the DV population, and being able to, again, do this One Health approach with the animals really helps them get out of that negative situation. Perdón, Nadia.
Y bueno, luego creo que es como de manera transversal, tanto lo que les está pasando en varias experiencias de los Estados Unidos como aquí. O sea, el tener acceso al derecho a una vivienda digna, que sea accesible, que la puedas mantener y demás, es muy complicado también. Nosotras estamos en uno de los sitios de España donde el metro cuadrado de alquiler es el segundo más alto después de Barcelona. Entonces, claro, es como también bastante difícil, ¿no?, en ciertas ocasiones donde sí que hay una alternativa habitacional para gente que está en exclusión residencial grave, y bueno, las separaciones forzosas con sus animales es bastante dramático. Y bueno, un poco por comentar que, bueno, creo que es la misma situación en varias latitudes.
Ay, gracias. Desafortunadamente, nuestro tiempo de preguntas y respuestas ha terminado. Les quiero agradecer a ustedes dos por darnos su tiempo y compartir su experiencia. Todas hemos aprendido mucho de ustedes. Unfortunately, our Q&A time is over, but I want to thank all of our amazing presenters for their time and sharing their expertise. We have all learned so much. I love that, from LA to Washington to Spain, like, you guys are doing such amazing and badass work, and just thank you so much. I've learned so much. So we totally went over our break. We're going to bring everyone back at 3:45, and it's 3:41. So if folks can just take like a 5-minute break, and then we'll come back. And am I getting that right, Christine, or am I messing up the flow of things?
That's right.
Okay, so 4 minutes, and then we'll come back.